Hello, this is my 9-week update on incontinence and sexual function. I just went to my first follow-up with my surgeon, and my PSA is undetectable, which is great. I just wanted to say something about the diagnosis. Is my PSA just slowly rose over the past few years up to just 4.4, and my urologist, who I went to for something unrelated, did a digital exam and found hardness, so that's when he suggested a biopsy. So I know the controversy about the PSA, but you need to keep on top of it and have yourself checked by a urologist if there's any elevation in PSA. It might be just normal. On the incontinence side, I'm what I would call 99% cured of that or better of that. I attribute most of it to the help of my pelvic floor physical therapist, who is a person who is specially trained in that area for helping men. Just helped me with the Kegels and different exercises to help that. I progressed from wearing a guard, which is the thicker pad, and I wanted to show some things. So people have been asking me, this is the Depends guards. It's hard to see that, but they're much thicker, and now I only wear the Depends shields. They're very, very thin, and as a matter of fact, when I just went back to my surgeon, he said, don't wear those anymore when you're at home, because it's some kind of mental thing that would prevent me from getting better. I just have really no leaks at all, even coughing or sneezing. The only time I've had any problem is if I've had a beer in the afternoon. I've had 2 severe leaks while I'm sleeping. And so now if I have a beer, I will wear a guard at night just in case, but that's even getting better, and I was told that would get better. So that's a much improvement. I still do my Kegels, my pelvic floor exercises, but I've stopped going to the pelvic floor therapist at the suggestion of my surgeon. He said I don't need that anymore, especially since it's out of network and then my insurance doesn't cover it. On the erectile dysfunction side, I still have 0 erections. I'm still doing the regimen that my surgeon told me to do, which is tadalafil daily 5 milligrams, and twice a week on Tuesdays and Saturdays 15 milligrams of tadalafil, and then daily with the vacuum erection device, this is the vacuum erection device that they suggested I use. It's made by a company called Unison, UYNSEN. What I have seen, though, is an improvement when I'm using the vacuum device. I'm getting larger, longer, stronger, more normal-looking erection in the erection device, but it doesn't last afterwards. It just goes away. It was suggested by my surgeon. I'm sorry I'm looking away because I'm reading my notes. I don't want to try and miss anything. He said that in the next 3-month checkup that I go to, if I still don't have any improvement in the erection department, they will suggest ICI, which is an intracavernosal injections, which is injecting a drug called a trimix into your penis, and it gives you an erection. He said that would also help with the rehab part, if that's still a problem. I still have sensitivity in my penis. I can have an orgasm by pleasing myself even without an erection, so I still have what I would consider nerve function. But what the word is that I've been getting from several different people is patience, and that's what we all have to have with this rehab after the surgery. And also I want to just mention again that everyone's recovery is going to vary. I've watched YouTube videos of men at my stage who've recovered all of their functions, and I've watched ones where they've gone at a much longer time for continence and ED to resolve. So Every one of us is different, and I hope that all of you are progressing well with your recovery. And if you have any questions, just please comment below. Thank you.